I want to go ahead and share my screen with you. This is the ICF model, and it is a base plan for organizing and documenting functioning and disability. So it has many dimensions that tie into health and overall, you know, disability. So um, we're going to go ahead and go over factors. So the ICF model, again, it's a dynamic interaction between the state of an individual's health, environmental factors, and personal factors. These are all different variables that tie into each other and into each individual case as far as healthcare. The health condition factor, which would be at the top of the model, is affected by body functions, structures, activities the person does, their participation in life situations, as well as personal and environmental elements. So in terms of athletic training, the ICF model does create, a more clear picture for athletic trainers when they're looking at different scenarios, because there's all kinds of uh, different patients that come in with different injuries, different backgrounds. So this allows athletic trainers to give, the best care possible based on education of information of what they know. And creating this ICF model uh, does help, improve healthcare. So I'm going to go ahead and show you an example of my ICF model that I created. So at the top, you have your health condition. I went ahead and went with the injury of a torn ACL. And then of course, in the middle, you have three factors. So you have your body function and structures. So your impairments, how are you limited from an anatomical and biomechanical perspective, how your body moves, how is it affected, you know, going from a normal state to an injured state. So this patient does have a restraint in terms of the medial femoral condyle. So there's an increase in displacement because, again, the ACL is torn. And then there's going to be an anterior tibial translation. So what that is let me see if I can go ahead and describe this. So basically, there's an indentation between the tibia and the femur. So if you have an ACL tear, typically it's measured in millimeters. The indentation is greater than 7 millimeters. So if it's 7 and above, that's typically how you know that there is an ACL tear. Of course, there's an increase in external rotation of your tibia on your leg because, again, there's nothing stabilizing it. Uh, your ACL is completely torn. And again, you do have a decrease in knee flexion and extension because your ACL, your anterior cruciate ligament, is located on your knee. It does have to do, with that function, the flexion and extension. Of course, the patient, as far as activity limitation, they can't walk, they can't run, they can't jump, they cannot squat. So anything knee related, that has to do with, again, flexion and extension, because the knee is so unstable from the tearing of the ACL. And of course, this particular uh, client cannot participate in work and football practice, which is what they're mainly invested in their everyday life, because uh, the patient I chose was a student athlete. So personal factors, this is a 22-year-old male. And then as far as environmental factors, he is a junior D1 football running back. He does have Obamacare. He came from a low income background, and he does have two parents in his household.